Hello, I'm Chris Stone. I'm a Senior Research Associate in the School of Psychological Science at the University of Bristol. I'm also a member of the MRC Integrative Epidemiology Unit and the Integrative Cancer Epidemiology Programme, which is funded by Cancer Research UK. My work is around using wearable technology to capture behavioural data in people's natural environment. Traditionally, psychological research takes place in the laboratory, where conditions can be controlled and one variable is manipulated in isolation to study its effect on another. However, the laboratory setting doesn't reflect the reality of human life. Now, mobile and wearable technology gives us the ability to measure human behaviour in the wild, using the array of sensors available in commonplace devices such as our phones and smartwatches. We can also use this technology to drive behaviour change by delivering timely and targeted interventions for health-related behaviours such as smoking. Smoking is the primary cause of preventable illness and premature death, harming nearly every organ of the body and reducing both quality of life and life expectancy. Stopping smoking brings a number of health benefits, some relatively quickly and others on a more sustained basis as smoking cessation continues. For cancer patients, these health benefits may be even more valuable. But quitting is notoriously difficult, and many have tried all sorts of ways to stop smoking with limited success. We need to find innovative methods of helping smokers quit that can be proven to be effective. For those who are trying to give up, an initial lapse is likely to lead to a full relapse to smoking. Therefore, if we can identify this point of lapse and deliver an intervention at that point, we have an opportunity to improve the success of the quit attempt. We've developed a system that uses the motion sensors in a smartwatch to identify hand movements which have the characteristic signature of cigarette smoking, and we've validated this system with smokers in free living conditions using commercially available smartwatch devices. We can use this wearable system to detect when a smoking lapse takes place. Then, using the messaging capabilities of the smartwatch, we can automatically deliver a relapse prevention intervention to the patient, tailored to their circumstances, just at the moment it is needed. We call this a just-in-time adaptive intervention. We're now carrying out an 18-month project to develop and evaluate this intervention, which is part of the Integrative Cancer Epidemiology Programme here in Bristol. We'll be working in partnership with a stakeholder panel of cancer patients who will advise us on all aspects of the intervention as we progress through the project. We'll also be seeking feedback from cancer patients at various points of the intervention's design, then testing the intervention and exploring its feasibility on a representative sample of target users. Research like this is a team effort, and I'd like to acknowledge the contribution of collaborators in this work, particularly my colleagues in the Tobacco and Alcohol Research Group at the University of Bristol. In carrying out this project, we hope to harness the latest thinking in intervention design and deliver it in a convenient wearable package with minimal burden to the user and maximum engagement with behaviour change, and in doing so, make a difference to people's lives. Please get in touch if you have any questions. My email address is chris.stone@bristol.ac.uk. Thank you for listening.